Actually, I want to thank you for accepting our invitation, for giving the lecture about the writing systematic reviews, and especially in dentistry, as I'm a dentist. And
Yes, excellent.
we are happy to have you here.
Thank you.
And just a brief introduction about the webinar and you, and then we can start the webinar if you agree.
Okay, I agree with every point. Yes, exactly. Yes.
Actually, Professor Serge Brand is our visiting professor in Tehran University of Medical Sciences, and he's a professor in psychiatry department of University of Basel. We are happy to have the webinar with the title of How to Find the Catchy Topics in Dental Sciences for Writing Systematic Reviews. You can start now, and we will, of course, enjoy your presentation.
Okay, thank you. Let's see at the end if you enjoyed the presentation. At any rate, thank you so much for the invitation. Thank you so much also for accepting my topic. And thank you for listening to me and have the patience to listen to my information.
Professor Brand, I'm very sorry to interrupt.
Tell me.
I'm just gonna say that all the participants, they can ask their questions via raising their hand, or they can write their questions in the chat box.
Yes.
And if you agree, we can have a question and answer part at the end of the session.
Yes, absolutely. Yes, yes, this is an excellent, this is a very nice procedure. Absolutely. Yes, thank you so much.
Thank you very much. Thank you.
You're welcome. Okay, so to start, things are difficult at the very beginning. Because the key question is, why do you want to write a review? Why the hell are you eager to write a review? And you see that already with this question, you start thinking about your motivations. And we will focus on this point later on. Then the next question is, are there different types of reviews? And the answer is albatte. And what are the differences between a systematic review and meta-analysis? And I also want to stress that I do reviews, about 200 reviews per year for scientific paper, for journals, different journals and different topics. And the question arises, are there also poor reviews? And the answer is albatte. But then the next question is, why are there poor reviews? And why are they published anyway? The next point is, with whom should I write a review? This seems perhaps a simple question, a stupid question. And our impulse is, of course, I write the review with my boss because he or she forces me. And I write the review with my colleagues because they are nice and they are smart and I love working with them together. But perhaps they don't have the exact and the correct expertise in the field. And then we shift to the key question, how to find a catchy topic. A good question, excellent question, not that easy to answer to. And my point of view as a psychologist is the best model of a cat is a cat. This means I will show you examples from papers, and I also send these papers to Dr. Shini Forouche, and you can ask her to get these papers as PDF files. And what is also very important to you is that my personal point of view is rather skeptical. it is important to know that my attitude is critical and skeptical towards reviews. So keep this please in mind when you have the impression that what this guy is talking is somehow spoiling and discouraging my motivation to write a review. But yes, take it as a challenge. We know that since the beginning of 2020, we are experiencing the COVID-19 pandemic, but since 5 to 10 years, we are living also the pandemic of systematic review and meta-analysis. Importantly, you don't have to share my point of view. It's really very important. And I hope that you're not too discouraged to trying to run a meta-analysis or a systematic review. I hope you do not start drinking alcohol because of this disappointing news. I mentioned the key motivation. Why should I write a review or run a meta-analysis? Currently, we experience that a lot of studies are on hold because of the pandemic. And so, for example, some of my master's students and doctoral students are have a timeout. They cannot continue with their studies. And so they ask me to, why not writing a review? So one motivation might be that we do not have our own data. And reviews and the meta-analysis you can write at home on your own desktop, and you don't have to see any patients or other people. You just can do this at home. A further motivation might be that reviews might get highly cited. So this means that if the review is nicely done and above all relevant to the field you are working on, then chances are high that this review or this meta-analysis will be highly cited. And of course, this has an impact on your scientific profile. You can increase, you can boost your scientific profile. And you can also increase your chances to get funding. At least here, it's always a rat race, a competition, and you have to show that you publish a lot and that you publish high, such to increase the chances to get funding for your research. But of course, we can also be very curious and having some research questions, and we try to answer to such questions. Why not? And writing a review or running a meta-analysis also means that I acquire new and further skills, because it seems easy just writing or reading manuscripts or papers and assembling the key results together, but it's not that simple. So to run a review or a systematic review, or to run a meta-analysis, means I do acquire skills, and I also always can list such skills on my CV to say I do not know only how to repair the teeth, but I also know how to run a systematic review. As I told you, the best model of a cat is a cat. And the question is, are there different types of reviews? And the answer is, of course, yes. Here we have written a systematic review, and we means Professor Khazaye, Dr. Zakiye, and their colleagues in Kermanshah, and together with our postdoc from Isfahan, and she is now a research fellow in the USA. Dr. Sadari Mahwani, we have run a systematic review on the relation between sleep problems and self-injury. We were convinced that this topic is highly relevant, both for people doing research on sleep, but also working in psychiatric fields, because we know that above all, adolescents and young adults have a dramatically increased risk to show behavior of self-injury. And so we were convinced that this topic is a relevant topic. On the screen, you see typically how the process was to gather and to select, to include and to exclude the papers. Whenever you wish to run a review, you cannot eschew from this graph. Every nicely run review shows you this graph because it's really important to the readers to know how did you manage to select your papers, because the selection, the inclusion and the exclusion of papers have a dramatic impact on the pattern of result you find out at the end. But you don't have to invent once again the fire, or you don't have to invent the wheel again, or electricity, or how to produce dough, because this has already been done by other people before us. Or in other words, I highly suggest you to give a close look to the homepage of the PRISMA statement. PRISMA is an acronym to design or describe the preferring reporting items for systematic reviews and meta-analysis statement. So it means that on this homepage, you find all relevant information, the basic requirements to run either a systematic review or a meta-analysis. Next, there is the homepage called Prospero, but it's at the same homepage as the PRISMA, because high-end journals ask you, in case you want to publish your review or your meta-analysis, that you got it registered on their homepage, register, or on any other internationally accepted and established register. In the meanwhile, you cannot publish reviews anymore or meta-analysis without showing the register code of this Prospero homepage or another relevant internationally accepted register. Why is it important to register your review or the systematic review or your meta-analysis? Because it also helps you to find out at a very quick and first glance, what did other people already do in that field? And here you see the citation of the homepage, and this sentence says, to help avoid unplanned duplication. So if you have chosen a topic and you find out that 2 weeks ago, other group has already registered the topic you wanted to choose, either you delete your project and you cry for a week, or you can ask to join this group. But at any rate, it does not make a great deal of sense that you run exactly the same review or meta-analysis with the exactly same topic. Further, going to this register may also help you to see how and why did other researchers run their review or meta-analysis. Again, the best model of a cat is a cat, and you can learn a lot from other papers in case they are nicely written and they are nicely published in well and internationally accepted journals. There is also the possibility of narrative review. And the question is, what is a narrative review? Why not systematic? What is the difference? And the difference is the following. Authors do choose a topic. Authors decide the range of the topic. And authors decide which papers are included and excluded. Importantly, such selections are personal choices and preferences. As an example, last year we published a narrative review on sleep and psychological functioning of children and adolescents, a narrative review. It has been published in a journal, in a German journal on child and adolescent psychiatry, a journal which is well established in the German part of Europe. So let's say in Germany, Switzerland, and Austria. Why narrative and why not systematic? The answer is very easy to give. Here I did list you the chapters. And from the list of the chapters, you see that the topics have been chosen by us, or we did choose the topics based on personal preferences or personal experience and expertise. So the first chapter was the background. The background means what is sleep in children, adolescents, and young adults. And then the second chapter was sleep of children and adolescents within a family system. And you see here to focus on the topic, does sleep of children and adolescents be connected to the family system? Was a decision, was a choice we have taken based on our expertise. More precisely to show is that Zachary Lemola and Nadim Kalak and Marcus Gerber and I, we have already some publications on the topic of sleep of children and adolescents within their family system. And so we were convinced that we have the expertise to write a small chapter about this topic. You also see that with this kind of decision, we also decided not to focus on other topics. We could have focused on the sleep of children, adolescents in orphanatrophies or in refugee camps, but we didn't do, and we did not have to explain or justify our decisions. The third chapter was sleep and psychological well-being in the first 3 decades, so from birth to the age of 30, because we said we want to give an overview of sleep patterns from newborn babies to 30 years old young adults. And to this end, we decided to exclusively focus on longitudinal studies. You see here, once again, it was our decision. Nobody could tell us, not even the editor, of the journal. Why or why not we have taken these decisions, but we decided in a group, in a team, if we want to write about sleep and psychological well-being in the first 3 decades, we only focus on longitudinal studies and not cross-sectional studies. The 4th chapter was on sleep and well-being and media. So media means online platforms and above all also social network sites such as Instagram or Facebook or Telegram or WhatsApp. And media, we narrowed this media only on smartphones and tablets used in bed, so before sleeping. So again, we decided not to take into consideration the use of desktop devices for work, for example, or for joining a lecture, but we said we want to focus on tablets and only smartphones when used for leisure time activities and getting connected with my social environment. The 5th topic was sleep, well-being, and physical activity. Simply because, let me see, simply because Uwe Püse, Sebastian Ludiger, Markus Gerber, and I, we are working in the Department of Sports Sciences, and so we were quite confident that we know something about physical activity in combination with sleep. And then the 6th topic, the 6th chapter was, we clearly defined it as selected topics. And we focused on sleep in very preterm children and children with cleft lip and palate. Why such a selection? Simply because, for example, Zachary Lemola has got a grant Zachary Lemola and I, we got a grant on sleep and psychological functioning in very preterm children. So very preterm means delivery occurred in about the 30s or 33rd week of gestation. So they were technically or physiologically, they were not ready to come to Earth and be born. And we wanted to know, what do we know about such children and about sleep on such children, and also focusing on children with cleft lip and palate. I mean, this might be interesting for the research in dentistry. This was a personal choice because we have run several studies, several means 3 studies, together with the cleft lip surgeons of the University Hospital of Basel. And so we could say, okay, we have chosen these topics because we have the expertise. And while choosing such topics, we also excluded a lot of other topics. But again, the narrative review has the huge advantage that as an author, I can choose, I can select, I can decide, and I don't have to justify or not fully justify why we have taken such decisions. So we have talked about systematic reviews, we have talked about narrative reviews, and now there are also, of course, scoping reviews. But what is a scoping review? Why is science so difficult? The answer is the following. I can have the impression that there is no systematic research on a topic. Authors do decide the topic. And here it's really very important. Authors have a huge knowledge and overview on the topics, and authors try to find new avenues. again, if you want to write a review or run a meta-analysis, it means that you have huge expertise to know what is already published and important in my field of research. And you can answer to such questions only when you have achieved a very good to high level of expertise in your field. I have chosen the following topic. First, there is the disease of multiple sclerosis. And within the disease of multiple sclerosis, we know that about 40 to 90% of adults with multiple sclerosis also report sexual dysfunctions. And these authors, Jana Pöttgen and her colleagues, were asking what might be the relation between sexual dysfunctions and neuropsychiatric aspects and the treatment of both sexual dysfunction and neuropsychiatric treatments. Neuropsychiatric aspects, I'm sorry. So you see, these authors are experts in the field of multiple sclerosis. They are experts in the field of a very relevant topic in an adult's life, namely sexuality, sexual activity, and sexual dysfunctions. And they were asking how might such sexual dysfunction be related to aspects of depression, anxiety, shame, insecurity, and how might, or substance use, of course, also medications, and what might be a treatment option to cope with sexual dysfunction and with neuropsychiatric aspects. And above all, they did not ask how to treat, but treatment, psychological treatments. So you see that they were highly expert in a broad range of fields of research. In MS, sexual dysfunctions, psychiatry, clinical psychology, and psychological treatments, psychotherapy. And they just were curious to know what is on the market to answer to such topics. On this slide, it's not important to read everything, so it's just the abstract of their publication. But I want to stress here the method. They clearly declare it's a scoping review, and they had the following questions. And so the aim of their scoping review to give answer to their two questions they had. And here you see the conclusions. Again, it's not important to know the details, but again, it's important to get familiar with the idea of a scoping review, because scoping reviews basically and often pave the ground for more systematic research, but also more systematic interventions. And as you also see here, again, I would like to stress that they did also register their scoping review in the Prospero homepage. So what we have learned until now, if we did learn something, we learned that there are at least three different types. There are three different types of reviews. There are systematic reviews, there are narrative reviews, and there are scoping reviews. And all three types of reviews ask a very high end of expertise. This is very important. I skip back to this systematic review. I'm sorry. I skip back to this systematic review and I show you the combination of the team. This means Professor Khazaye is sleep researcher, and he is running the sleep center, sleep disorders research center in Kermanshah. Ali Zahieh, Dr. Ali Zahieh is a clinical psychologist and psychotherapist, so he knows a lot about psychiatry and treatment. And just to go on, I would like to say that the team put together is a team of experts in different fields. So my field is not such systematic reviews, but my field is of research and expertise is sleep research and also psychotherapy and psychiatry. The same holds true also for Dr. Saderi Bahmani. So I just want to underline that when you want to run a systematic review or a narrative review or a scoping review, it's important to put your team together with high-end expertise. The same holds true also here. We were all experts in the field of sleep, of psychiatry, on exercising, on treatment of preterm children. And this is again very important. It's not about doing a favor to my friend or doing a favor to my colleague sharing the same office. It's really a question of putting together experts in their fields such that experts do work together to perform a high-end product. So we have talked about systematic reviews, narrative reviews, and scoping reviews. The question is, what is the difference between a review and a meta-analysis? Basically, a systematic or a review is describing all available publications in the field. And a meta-analysis, as the term already underlines, it is a question of statistics. And it is a question of statistics to put previous statistics together to a high-end or a higher level statistics, so a so-called meta-analysis. What we do here is our statistical procedures to investigate if there are statistically significant difference, for example, between samples or cohorts or cases. To show two examples, we got published this year at Frontiers in Immunology, a meta-analysis, a meta-regression on serum and plasma tumor necrosis factor alpha levels in individuals with obstructive sleep apnea syndrome. From the team, you see that we were experts in the field of sleep disorders, again, Professor Khazaye, then our fellow, Dr. Saderi Bahmani, me, and then there were also experts in the fields to run meta-analysis and meta-regressions, and above all, also to know about immune system. So the choice to put this team together was not because we are nice or we are gentle or because we are nice looking or whatsoever, but it was, the team was put together based on our quality and our expertise in the research. The same holds also true for this topic, for example, acute effects of moderate aerobic exercise on specific aspects of executive function in different age and fitness groups, a meta-analysis. And you see here from the team put together that experts in the field of sleep are not involved, or experts in the field of immunology are not involved simply because they are not necessary. So again, the rule of thumb is that you need at least 50% of your time to run a review or meta-analysis, to put your team together and to know exactly what is the question you want to answer to. Are there also poor reviews? And the answer is Albate. I hope my colleagues did not cheat on me, because I asked them, how do I say, of course, in Farsi, and they said Albate. I hope this is true. Are there also poor reviews? And the answer is yes. To give a quick and comprehensive impression about the discussion, when is a review a poor review, I highly recommend you first to register at ResearchGate.net. It's a very nice research platform. You can exchange a lot of experiences. You can get a lot of answers to your scientific questions. You can learn a lot from other researchers. You can also upload your open access papers. And above all, you can also get a scoring beside the age index or your personal age index. You can also get the ResearchGate index. And this is also meaningful to show your degree of performance. So basically we have 3 scores. We have the Google Scholar. This Google Scholar often is much higher than other scores. I don't know exactly why, but yes. Then there is the age index. And this is most probably the most precise index to show your degree of publication and expertise. And there is also this ResearchGate.net index, which also represents and mirrors your scientific performance. So again, I invite you to register at ResearchGate.net, and then you can follow this discussion on low quality systematic reviews and meta-analysis misleading evidence. It's really nice. You can learn a lot, at least I did learn a lot, what other people think about systematic reviews and meta-analysis. And I was not unhappy to see that also a lot of other researchers have somehow a skeptical and critical attitude towards this, what I would call this pandemic of research. We have the problem that there are shareholders and stakeholders. So of course, editors and journals are eager to publish meta-analysis and systematic reviews, because if they are nicely done, so these papers are highly cited, and this of course have again an impact on the journals. But there's also a flip side, and the flip side means, above all, reviewers, given that reviewers do their work for free. As a reviewer, you do not earn money. You can earn knowledge. You can learn how to do something or not to do something. But you may imagine, as a reviewer, you should have a lot of time to check, for example, I switch back. For example, to check as a reviewer, I should check, has this selection been nicely done? Did they choose well the inclusion criteria and exclusion criteria? and which journals, papers did they include and exclude? Because again, the sample, the pool of the paper has a dramatic impact on the pattern of the results at the end of a review. And so you may imagine, as a reviewer, I am asked to check if they have chosen well the abbreviations, if they have chosen well the expressions, and if they have chosen well the exclusion and exclusion criteria. I switch forwards again. I'm sorry. And this means that as a reviewer, I think very well if I accept to review systematic review and a meta-analysis. Me personally, I need about 1 full day to review a manuscript on a systematic review or narrative review or meta-analysis. And so the question is, do I have time? I mean, a day is not nothing. If I want to do it, the review seriously and thoroughly, I need a lot of time. And so it's always up to me to decide, do I do the review or not? Basically, I reject because I don't have time to dedicate 1 full working day to a paper which does not belong to me or to my research group. And the last point is really to be very, very careful to absolute nonsense topics. So how to find a catchy topic? Finally, we come to the key question of the presentation. First of all, you as author, you must have an excellent overview in the field of interest. So this is also clear that a bachelor student and normally also a master student does not have the level and the overview to write a systematic review. Some master students or bachelor students, master students ask me, may I run a systematic review or meta-analysis on this topic as a bachelor thesis or master thesis? And at least I say always no, because they can only fail. They, as a bachelor student, as a master student, by default, by definition, they do not have and do not need the full overview over the topic. If a doctoral student wants to run a systematic review or narrative review or scoping review, then this is another question, because as a doctoral student, I can assume that she or he already have a huge knowledge or a high level of knowledge. So this means you must know what has been already published in this field. And you see this is very time consuming. It's not just clicking through PubMed or Google Scholar and entering two expressions and then to be happy that you have got everything. It's not the case. Then if you have the expertise and if you have a high and excellent overview on the top of the topic, it means that you also know where are the gaps of research. In this view, again, this homepage of the prospero.org or prisma.org may help you to find what did already other people do on this topic. Because you don't have to invent once again electricity or the wheel or the fire or how to produce yogurt or dough. If you want to combine 2 or more fields together, it means that you must find the team and put your team together. based on their expertise. And do not put your team together based on friendship or being gentle or thinking sort of trading, tit for tat. It's really important that you put together your team based on their expertise and knowledge. The sixth point is somehow a rule of thumb. If you want to go fast, do things alone. But if you want to go far, do things with a team and put your team together in a nicely fashion. So how to find a catchy topic or how to avoid nonsense? It means that, again, you must have the expertise and you must distinguish between topics of practical and clinical relevance compared to nonsense. I'm pretty sure you, also in Iran, you have such a device. You put the meat here and then this motor and this device chops the meat, and at the end it comes out in that way. Why is this device so important? Because the device chops any kind of meat you put here. The device does not tell you, have you chosen well or not meat? So it's up to you to put meat of chicken, turkey, beef, deer, rats, cats, dogs together, because at the end, something will come out. But again, the question is, do you really want to eat this if you have put different meats and uneatable meats together? And do you really want to eat this? So, as regards our topic, it means you can put any kind of topic together, run a systematic review, run a meta-analysis, and at the end, you always will have a result. But the question is it really eatable? Or is it really useful? Is it really necessary? Is it really an advancement in the field you are working on? And now you see why I'm rather skeptical to systematic reviews and meta-analysis, because at the end you can put any kind of data together and let them through this device or your software, statistics software, and at the end you will always have a result. The question is this really fine food or not? So, to get a bit more creative, there are apps. You will find apps in the App Store or in the Google App Store or where else, and you can such devices, such apps may help you to put together your ideas, and whenever you wish, you can add further ideas and topics together. So this procedure touches the topic of cognitive psychology, and in more specifically to divergent thinking. So it's a question of combining items together to get a new and above all meaningful product. Because you cannot put together, of course you can put together any kind of meat and let it through this device. But the question is the product really useful, eatable? Does it make sense or not? As a positive, very helpful example, I would like to underline this technique of mindfulness-based stress reduction. So this is a technique of awareness, of mindfulness, of relaxation, and it has been, let's say, formed in the 1970s by John Kabat-Zinn. He was medical doctor and biologist and PhD at the Massachusetts Institute of Technical, something like MIT. And he also had to treat patients with chronic pain. And he was aware that no topic or no method helps. And then he had the great idea to put new elements or elements, well-established elements, together to a new meaningful product. So he has taken methods from Hatha Yoga, from meditation, and from Buddhism meditation, Tibetan Zen meditation, to a new meaningful technique called mindfulness-based stress reduction. So again, his great creativity was not to invent new techniques, but his creativity and his smart mind was to take the techniques already available to a new and meaningful product. This is the screenshot of my notes, and you see that this is handwriting, and you will see that you are absolutely unable to read. And this is correct, because my handwriting basically, and no, basically, yes, basically is only for me. And I have taken all these notes within the last 10 days to put together topics for this current, for this present talk. And perhaps you will see, so the title was Dentistry. This perhaps you can identify. And then I put here also the date, so Montag, so Monday, and 8:30 in Basel, BS. And then I also used different colors, black, green, red, blue, and this, and green again. And this is my way to work and to put ideas together and to combine ideas and knowledge I have to a meaningful new product. Meaningful new product, at least I hope that the talk was somehow a meaningful new product to you. But again, it's important to me to show you how you can proceed to find out and to find a new smart or clever procedure for your topics. Here, I just had one expression, samples or participants, and I listed at least 7 different samples. So infants, toddlers, children, adolescents, young adults, elderly people, healthy samples, clinical samples, and this was at one glance 7 different samples. So it means if I want to choose a systematic topic for a systematic research, or for a scoping review, or for a narrative review, I already have the possibility to choose from a broad variety from samples and participants. Likewise, beside the sample and participants, I can also focus on the methods and on the sampling. There are cross-sectional data, longitudinal data, interventional data, retrospective data or chart reviews, subjective data, objective data, follow-up data, and. So again, you see you can combine different samples with different sampling methods, and you already get a huge amount of new questions and new fields. To keep things even more difficult, I added the areas. So I can choose, for example, combining dentistry with psychology, with psychiatry, with neurology, with surgery, with hygiene, with prevention, with epidemiology, and so on. And you see that as soon as you touch one further item, you open immediately a new area, a new broad area, because there is not the psychology, but the psychology consists of at least 30 different topics. You can take cognitive psychology, emotion psychology, coping with stress. You can decision making, problem solving, and. You see, with every single topic, you open a new field and you open further topics and yes, together. Likewise, there is not the psychiatry, but there are at least 10 chief diagnoses, and every chief diagnosis, let's say from dementia, from neurodegenerative diseases to personality disorders, they still have a lot of further subcategories. I tried to describe these 3 dimensions in a sort of a cube. And you see, we have here the samples, we have here the methods, and we have here the areas. And basically, you can combine these 3 areas, and I have listed for every dimension, I have listed 7 topics, but of course there are much more. And you see, combining areas, samples, and methods together, so 7 per 7 per 7, you have already the combination of 343 different topics. I hope I could give you the idea how to find new areas of research, new gaps of research, and how to be smart and how to avoid to repeat what other people already have done in previous meta-analysis or systematic reviews or scoping reviews or narrative reviews. However, and now we come to the end. The chief question is always, does the topic make sense? What are the practical and clinical implications of my review and of my meta-analysis? This also means that you must be expert in your field to have a thorough overview of the topics. And if you decide, for example, to combine food intake, carbohydrate intake, and caries in ancient populations, it means that you set up your team with experts in the field of dentistry, experts in the field of carbohydrate food intake, and experts in the field of archaeology, for example. As a psychologist, I'm too convinced that the best model of a cat is a cat. And so please learn from published meta-analysis and systematic reviews published in well-established journals. This is really important because there are a broad variety of journals and not all journals are really of high quality. Nevertheless, high quality journals do not prevent from publishing rubbish. It turned out in July that the New England Journal of Medicine, so this is a really high, one of the highest ends journal in the field of medicine. If you are able to publish something in the New England Journal of Medicine, then rest assured that you already belong to an elite. So, but what they did is they published a paper, a systematic review or an overview of COVID-19 in relation to a medication. and they published it. And of course, this was very catchy topic, and everybody wanted to also to contribute to this COVID-19 research. And then it turned out that these data, about 100,000 participants, imagine, they put together, assembled data from 100,000 participants from hospitals all over the world. It turned out that these data were all fake. Imagine, they faked data and they were able to publish such fake data in the New England Journal of Medicine. So I want to say that journals, well-established high-end journals, are somehow can give you a guarantee, can give you more security that if a meta-analysis or systematic review is published in such a journal, so quality should be quite high. Then again, I invite you to join this ResearchGate.net because it is a nice platform for both for researchers and both for novice, for beginners, and also for experts to exchange their knowledge. They have nice chat rooms, they have nice questions, and specifically, they also have now since some months, they also have this topic of low quality systematic reviews and meta-analysis, misleading evidence. And there you can follow what do other people think about this topic. Next, think about, do you want to really run a systematic review? Or do you want to run a narrative review? Or do you want to run a scoping review? All three reviews have advantages and disadvantages. At any rate, you cannot escape from being an expert. What any kind of review you run, you must be an expert in the field. And this also gives me the question to you back. Why not running a research? And why not running research studies instead of systematic reviews? Again, I do not ask you to share my point of view. By no means. I just want to underline that from my personal point of view, these systematic or reviews and meta-analysis is the pandemic in the science. I skip back. And if you take this model, samples, participants, methods, sampling, areas, and when you put this cube together and you see that at least 343 combinations are possible, then why not choosing one of such a topic to run your own research? Because I still am convinced that doing field research, doing interventions, doing cross-sectional and longitudinal studies are much more worth for the scientific community, but also for you and your personal skills. It's important that you learn, how do I run a study? How do I figure out a new topic? How do I run the study? How do I do the statistics? How do I present the results? And how do I write a manuscript? In my opinion, this is much more important than striving for systematic reviews and meta-analysis. But again, I underline these are my personal points of view, and you by no means you have to share this. As a last example, I got this email on, let me see, on October 12th of this year. And the topic was transcranial magnetic stimulation in obsessive compulsive disorder, request regarding your publications. And then they started, dear Dr. Serge Brand. This is okay. And perhaps you are unable to read. It's not important. We have 2 publications on RTMS, and we have published or run these studies in the psychiatric hospital from the Hamadan University of Medical Sciences. And we published these 2 public papers. And now there are some juniors on this planet, and they want to run a systematic review and meta-analysis. And imagine they asked me 9 specific questions. What is the resting and active motor threshold? What is the duration of the cortical silent period? What is the motor potential, amplitude, latency, and so on? And here I must say, why the heck should I answer to such questions? Because answering to such questions, these are highly sophisticated questions, would take me up to 3 days to go back to the data, to the raw data, to check the questionnaires, to check the protocols of every RTMS intervention, to check every intervention by time points, by person, and so on, where I must say clearly, I do not do this for nothing. I don't see the reason, and above all, I don't have the time. And I'm not willing to answer to such high-end sophisticated questions just because other people have figured out a very high-end or very complicated research question. I hope that you don't have the impression that I am mean, or I want to hinder other people, or I want to impede that other researchers are do their efforts. By no means. But I have to balance to answer into such difficult questions and my time budget and also my brain budget. And in that specific case, I wrote to these 2 juniors and I said, I don't have the time to dedicate such difficult, high-end, very specific questions and to give them the answer. Of course, they were not happy, but at the very end, they also have to cope with reality. Not all research questions are also interesting for other authors and researchers. So, Kheli Mamnoon for listening, for having this patience, and now I'm quite curious to know what are your questions, if there are questions.
Thank you, Professor, for your nice presentation, and of course, very useful.
You're welcome.
We have some questions in chat room, as I see.
Okay.
Dr. Aziz Kasani asked about, is it possible to explain PICO's criteria with title sample in dentistry?
Oh, wait, I cannot find it. Please explain PICO's criteria with a title sample in dentistry. Yes, PICO's is also a highly standardized procedure to run systematic reviews and meta-analysis. So it's not a question, which one do I want to choose? Do I take PICO's or Prisma or Prospero? No, Prospero is for the registration. It has not such an impact, but the importance is that you strictly follow the well-established algorithms defined by scientists. This is the point. And yes, I hope I could answer to this question.
Okay, thank you. Dr. Bayat asked about, would you mind talking about challenges of writing systematic reviews in interdisciplinary teams?
Mm-hmm. Yes, the challenge is to find experts in your field. This is the point. Again, you must be sure that if you ask somebody to join your team to write a systematic review or a meta-analysis, you must be sure that this person really has the knowledge to know also the overview of this topic. So, for example, you decide to run a systematic review and meta-analysis on anxiety, children's anxiety to go to the dentist in relation to mothers' anxiety. So it means you're a student or you're a professional in dentistry, then you need at least one pediatric or clinical psychologist in child and adolescent psychology. And then you need at least one further expert in the field of family systems. Okay? So it's important that when you put together your team, that you must have the confidence that these team members really know virtually everything about the question you are asking. Otherwise, if you just ask a junior because this junior is nice and gentle and nice looking and invites you for kebab or whatsoever, this is nice on the level of social commitment and social interaction, but it's pointless from the scientific point of view.
Okay.
I hope I could answer to this question.
And again, another question by the same person. As you said, you must be a specialist in systematic reviews.
I could not exactly. You must be a specialist in your field. So what is the role of generalists in systematic reviews? This is so the question is, as you said, you must be a specialist in your field. So what is the role of generalists in systematic reviews? It depends what the generalist is, but of course it means he or she perhaps has a huge knowledge from a broad sense of the topic. But again, I would be rather cautious, because at the end, it's always the expertise of people. It's always the expertise of people. So as an example, we have run a study in the Hamadan University of Medical Sciences. And we asked, but it was an intervention, it was a cross-sectional study, it was not a meta-analysis, but we were as clinical psychologists. So my colleagues, Professor Muhammad Ahmad Pana is clinical psychologist, Professor Muhammad Hariri is a psychiatrist, and we were convinced that children's anxiety to go to the dentist is related to the mother's anxiety to go to the dentist.
Yeah.
And so we asked dentists to join our team. We asked endocrinologists to join our team. And we have run this study with at least 3 different fields. So dentistry, psychology, clinical psychology, and endocrinology. And the overall result of the topic was that if we measure the stress hormone cortisol in the saliva of the child, we could calculate how the level of anxiety of the mother. So it means that the mother, it's not against mothers, by no means, but but the anxiety mothers have to go to the dentist and to be anxious that something harmful will happen to the child. So this attitude of anxiety is transferred to the child, and this anxiety is measurable via the increased cortisol secretion in the child's saliva. So as an example to say, we had the idea, Professor Ahmad Panna had the idea, he asked me, and then we put together the expert team to run this nice and very funny study, by the way. So I hope I could give this answer to this question.
Okay, and we have, I think, just 2 more questions.
Okay.
Dr. Shamshiri, first of all, I say hello to Dr. Shamshiri. He asked about that. He wrote, I can get the exact meaning of new product as systematic reviews output. Systematic review is a way to answer current practical questions, mainly clinical, with top valid evidences more precisely. I think he has a problem with the word new product as systematic reviews output.
Yes, okay. Yes, okay. So, yes, I understand. I just wanted to say that if I decide to run a systematic review or a narrative review or a scoping review, I must have excellent ideas. I must have a good team. I put together their knowledge, and the product of a new review must be catchy, new, interesting, and of practical importance. This is perhaps, yes, I put product into parentheses or into brackets to say it's not the question of producing a book or a new notebook or a pencil or duch or I don't know what, but it's a question. But because at the very end, a paper is always a product. If I write a paper and I try to get this paper published, at the very end, it's also about marketing. It's also about how can I put my research efforts in the field of the scientific community. I hope that I could fix and repair this misunderstanding.
Okay, thank you. And the other question is about what are the best databases for searching literature for systematic reviews?
The best databases surely are PubMed. In the field of psychology, PsycInfo. And to some extent also Scopus, but Scopus is fed by the Elsevier publisher. And so we do not know exactly if the publisher Elsevier does filter what is available in Scopus, because as a publisher, they have interest to sell their products, of course, and not to sell other products. I would not go for Google Scholar. First of all, Google puts together everything, and you have practically you have no chances to verify, is this useful what Google does present me? First, number two, you can say, okay, I just focus on English, on papers published in English. Because even if there is a very nicely run study, but published, let's say, in a Swedish language or Spanish language or Portuguese language, then I must say I have zero chances to verify what is really written in that paper. Of course, normally the abstract is also written in English, but how should I know what are the details of this study if I do not know Portuguese or Spanish or Swedish whatsoever? And so Google offers me a broad variety, a huge variety, in my opinion, a too large variety of information and publication, where I get lost in selecting and also knowing, is my selection a good selection? And from this point of view, I would not focus on Google Scholar. But again, these are decisions you have to take. But what is also clear is that if you do a thorough review and literature search, a thorough literature search on PubMed, and for example, now it comes into my mind, I have forgotten this to list in the slides, the Cochrane database. So we know that Cochrane, this was Alibert Cochrane, I think in the 80s, and he complained about this huge amount of different publications. And so he said, we need a database to put together all data, publications in one database. And so the idea of Cochrane analysis and systematic analysis was born. It goes back to this Alibert Cochrane. So go also to the Cochrane platform and homepage and check what has been published already on this topic. I hope this is sufficient.
Okay, again, I would like to thank you for your valuable presentation.
Okay,
Just the head of, the head of International Affairs of Tehran University of Medical Sciences, Professor Dr. Nekoufer, wants to speak with you. So I will.
Hello,
can
Professor.
You hear me?
Thank you very much for very, very informative, very important topic that you cover. And you know, between Tehran University of Medical Sciences and Switzerland, we have a lot of collaboration, and we know you also support this. We have a very good support from the Switzerland Embassy in Tehran as well for our collaboration. So we look forward to have you as one of our, let's say, virtual visiting professors of our university very soon. So we will work on that. We will send you our official invitation to become one of our virtual visiting professors very soon. By the way, I know Nassim prepared some sort of virtual certification as well, which is some sort of appreciation to you. So Nassim is going to show that and share that now with all of the participants. What am I going to ask from all participants to please turn on their microphone and turn on their video and put their hands together to say thank you to Professor. So we start, all of us start clapping for you and thank you. So everybody, please turn on your microphone. Please turn on your video as well. We like to take a group photo all together as well. So we go to gallery view and start saying thank you to Professor Serge Brand for very nice presentation, and we look forward to have you again. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you so much.
Thank you very much. That was
I really
for all of us from around the world.
Thank you very much.
Yes, please go ahead, everybody.
Okay.
Thank you. Thank you very much.
Thank you. Thank you.
I can see.
Thank you very much, Dr. Brand. Thank you.
Thank you. You're welcome. You're welcome. I really enjoyed to give you this talk, and I really appreciate your efforts that we can keep in touch and then that we can continue our collaboration. Thank you so much. Thank you.
Fantastic. So my colleague is going to take a group photo from all of us with you. This
Okay.
is an honor to have you as our virtual visiting professor, and I can promise that of Switzerland and Tehran University of Medical Sciences is going to prepare future webinar with you
Okay.
to give more information to this very small world. I'm saying that now the world is flattened according to this virtual communication.
Yes,
We are very
exactly.
happy.
Yes.
Now we have from Asian part to Switzerland to Europe, everywhere all together, and we put two hands together to fight with this coronavirus as well.
Yes,
Thank you very much indeed.
Yes, you're welcome. Thank you
So
so much.
Nassim, are you going
Thank
to share the certification with everybody?
Okay, just a minute. I will.
Thank you very much, Professor. This is the certificate of appreciation.
Okay, excellent. Super. Thank you so much. Thank you.
Good to see you and hope to see you soon again.
Yes, I'm very confident. I'm very confident. Yes, thank you so much. Thank you.
Thank you. Good.
You're welcome. Okay, we can finish now. Again,
Yes, okay.
I thank you, and I hope we have more and more webinars, especially in dentistry, who I'm specialized in this field,
Yes,
and of course in other fields in our university. Thank you again.
Yes, I'm looking
and hope to see you
forward
soon.
Yes, okay. Thank you so much. Goodbye.
Thank you.
Cheers.
Bye-bye.
Cheers.
Thank you, Dr.
Bye-bye.
Brand.
Goodbye. Goodbye.
Bye.
Thank you. That was informative and deepened my thinking.